ask you something. If someone reviewed your last 10 chart notes in your EMR, would you feel confident? I want that to sit with you for a second. Not hopeful. Would you feel confident? For those of you guys don't know me, I am Amy Plano, the reimbursement dietitian, and I'm always here to simplify the reimbursement process as much as humanly possible. Most dietitians I work with don't feel panicked about their documentation, but they also don't feel 100% confident. It's more like, I think it's good, or I think I included what matters, or I think this would hold up. And that, I think, is the main problem. So let's take the word audit out of this whole video for a second, because I know that makes a lot of you guys break out in a cold sweat, and that is not what we're here to do today. Because in all honesty, this video isn't really about audits. It's really about clarity with your documentation. So this video today is really about, would your documentation clearly support the care you provided to your awesome patients? Would another provider picking up your note understand what happened in the session? Even more so, would another provider be able to follow the storyline of what happened from visit to visit with your patient? So without you needing to explain it or fill in the dots, right? That's the standard in terms of documentation, not perfection. It's really for you guys getting clearer and understanding with complete confidence and clarity how to document, right? So when I personally look at a chart note, and you guys know I do this a lot, I do this for my team once a week, and I review generally 2 to 3 notes per dietitian on my team. I'm not asking, is this note long enough? Is it detailed enough? I'm asking really 3 things that I want to talk about today. Number 1, what I'm looking for, is it clear what was basically assessed, right? So not just that you reviewed intake, right? Oh, I did a 24-hour recall, but what actually stood out, right? What changed? What is relevant, right? Dietitians are really good documenters per se, right? They're able to put a lot of detail in the note, but like, what is your honest assessment of the information as a nutrition professional of the information presented? I'll just give you one example. So like, say somebody did a 24-hour recall on a patient and they were presenting, today for family history of cardiovascular disease. And the dietitian noted that the diet was low in fiber, right? When I am doing a chart assessment and I'm reviewing the dietitian's notes, like, I want to know qualitatively, what is the definition of a low fiber diet, right? So if the dietitian just said diet is low in fiber, right? That seems good in theory, but why is that significant? And what would qualify as a diet that's low in fiber? Do you see where I'm going with this? Because a lot of dietitians put a lot of details in, but they don't make an assessment of what that data really means, right? The second piece, right? Is it clear what you did with the patient? I often feel like you guys are really good historians, but you are not detailing the interventions that you provided. And the messed up part is you're actually providing the interventions. You just seems to miss this when you're writing your note. So it's not about provided education, but what specifically did you address, right? And so if a patient is coming to you with a family history of heart disease, right, and you're looking at fiber, right, you're probably going to educate them about the role of, say, soluble versus insoluble fiber and maybe the impact it can have on cholesterol levels, right? You probably might educate them on the difference between HDL and LDL so they feel confident after they leave the session, right? Not just provided education on a heart healthy diet. I fucking hate that. That drives me crazy when I see that in a note. Like, what is a heart healthy diet and why does it matter in this patient's particular situation? So, in this area, when I say, is it clear what you did? What recommendations did you give? And what was reinforced or adjusted because of your assessment, right? And then this piece, even my team, I feel like we don't always nail this piece, but is it clear why continued care for this patient is needed? Okay. Especially if you are seeing them with increased cadence. And I define increased cadence as seeing a patient any more frequently than like 2 times per month, right? If you're seeing them weekly, why do they need continued care that often? This has to be super relevant and evident, right? This is where a lot of notes fall short. You know, you mentioned progress in your note, but the why behind why follow up is needed is not always clear. So, what still needs support for the patient, right? What are you monitoring? What's the motherfucking plan, right? So, we want to be crystal clear with the continuity of care, right? This is also where we would insert, like, did we talk to the patient's therapist? Did we send this note to the patient's PCP or endocrinologist, right? So, like, continuity of care is kind of like this holistic approach with how we're working with the patient, right? So, what I want to say in closing in this video is here's what I see often with you guys. It's not that your note is wrong, it's just that it's not fully clear. It has good information, it has the right sections because that's what we know how to do as dietitians. And to be very honest, it has the right intent, right? You guys are working really hard on your documentation. It's just not fully clear and probably supporting the medical necessity that you need. But someone in reading it still might have to connect the dots. And that's definitely not what we want to do in a chart note, right? Your documentation should not require interpretation. I'm going to say that again. Your documentation should not require interpretation, right? So, but just to be very clear, I'm not here to fearmonger, right? I think a lot of you guys are doing really incredible documentation because it's not about catching mistakes. It's not about doing it wrong. Most dietitians are doing a lot of things right already. You just need to tighten it up, right? So your notes reflect your clinical thinking. So your notes clearly support the services you provided. So your notes feel like a level of comfort when you close them, not a level of fear and uncertainty, right? Because once you guys have that clarity regarding documentation, you stop second guessing and you stop wondering, is this documentation enough? Would this hold up? You just know, right? And so if and when an audit comes, which at some point it will, it's not a punitive thing, it's really a non-issue, right? It's anticlimactic because you know that your notes already have everything in them that you need. So hopefully that gave you a little bit of clarity. If you guys need more support with documentation, we're going to put the link below. I have an excellent webinar that shows you exactly what needs to be in your notes, where dietitians get a little bit kind of off the path, and then how to tighten your documentation without overly complicating it, right? You guys get access to a handful of notes. I give you a checklist in that webinar. What else do I give you? Oh, and I also give you the sheet that I actually use on a weekly basis when I do assess documentation of my team, right? So I just want to be clear. I think most of you guys are doing a great job. There's just a handful of things we need to tighten up. And hopefully those 3 things that we talked about today, right? You can go back to your notes tomorrow and make some small adjustments. And if you want some step-by-step examples, hit up the link below this video. And like I said, we will show you all things documentation, including examples, checklists, and all of the things, right? Hopefully this helps. Stop freaking out. Let's get you some confidence. And like I said, You guys are doing 90% of the work correctly. We just need to clean up that last 10%. So, Amy Plano, the reimbursement dietitian, once again, just trying to simplify the reimbursement process for all of you guys accepting insurance. See you guys next week.